something that it'd be a disaster if we could then get hit as well.
It's an airborne virus.
Exactly, and it's interesting that all the precautions that they did eventually introduce to try and control the spread of COVID didn't work that well to control the spread of COVID. It seemed to work pretty well at controlling the spread of flu, possibly at least. Actually, this is quite interesting. There are lots of issues around the way in which it was introduced and dealt with that I would like if I could get. So just some of the headlines that I picked up on that we might want to discuss. That we can find the paper I was scribbling on. In workplaces, there's a whole business about how the risk assessments were done by employers, what sort of measures they thought would be ones that were appropriate to try and help control the risk in the workplace. There was a whole issue about worker consultation, whether or not there was effective consultation with workers and with union reps on how the process could be managed. There was the whole process of it when they introduced lockdowns, it started saying would people like to work from home unless they're providing essential services. How that was involved, there's lots of issues come out of that, both in terms of the way in which the workers were sent home, people who got the later to when employers decided they wanted them back in the office, but also the way in which the essential workers were treated when they were actually still on the floor and deal face to face with the risk of treatment. There's all the stuff about how the regulations and guidance were introduced, the quality of the guidance was introduced. A lot of the public health guidance was very, very poor and probably misguidance in some respects because they didn't admit till far too late on in the process that there was a variable and contributed infection risk, for example. And that's despite the fact that HSC's research people were actually working on the premise that it was an airborne infection and were doing a lot of work on ventilation and spreading it not just as droplets but as aerosols that spread more widely from months into the pandemic. It seemed to take about 8 or 10 months for the work that they were doing on the research side that became through into the policy side of stuff. It's quite bizarre, and convincing the evidence was for that. There's a whole discussion around test and trace and the way that was done. The bizarre is instead of a totally new test and trace system, rather than use test and trace system that had worked in the past for other infection outbreaks that were run by regional public health directors and environmental health teams who are used to handling it, and whether or not this is not the system wasn't very effective in its use of trying to do with test and trace. Crucially, from the workplace point of view, there's the role that the HSE played or didn't play in the process. And that extends as well to local authorities because they enforce health and safety for 50% of the workforce, 50% of the premises. Obviously, the environmental health as well, that's based on the infection because of their role as public health business, but their role as investigating workplace infections and outbreaks is probably quite problematic too. I think there's a big discussion to be had around the fact that it was an airborne infection, the importance of ventilation and air purification in reducing the risks and the way that was handled so badly. And then, crucially for me, there's a big discussion around the inequalities, health inequalities involved in this. The fact there was black and minority ethnic workers who are much more exposed to the risk, and those sorts of issues as well reflect on. So those are the sorts of headlines that I sort of very quickly scribbled, partly based in fact on the Scottish hazards evidence that was submitted to a very useful document. You've been given some documents to help with your thoughts on the issue, and I think probably it might be a good idea just to give you a few minutes just to skim through them and see what you can think of.
It would be good to let people introduce themselves.
Sorry, yes, I should have done that at the beginning.
Please speak up, sorry, as well. Microphone's not so good.
Do you want to start introducing Andrea?
Yeah, I'm Andrea Oates. I'm a freelance journalist, and I write the health and safety content for Labour Research Department publications.
Hi, I'm Jonathan Flux, I'm a retired GP. I'm COVID lead for Doctors in Unite, and I'm also on the COVID Pledge organising group.
I'm Kathy Jenkins, and I'm my branch officer from my Unite not-for-profit branch in Edinburgh, but I'm here from Scottish Hazards.
Hi, I'm Jo McNulty, I'm a branch officer for Unison. I'm the chair of National Health and Safety and North West Regional Health and Safety Committees.
Are any of you online?
I'm Alex Lancaster, and I am a health and safety official at the University College of Union.
Yeah.
Really introduce yourself.
Oh, sorry, that was actually introduced at the very start. I'm Doug Russell. I'm retired health and safety officer for the Union of Shop Distributed and Allied Workers and a member of the Greater Manchester Hazards Management Committee.
Yeah, if you want to read, I'll just going to get the techie person, see if we can increase the volume for people at home.
Okay, that'd be good.
While
Well,
you-
while that's being done, just take your time to scan through the documents that you've got there and we'll start the discussion.
Perhaps I should just say as well is that we want to make it as informal as possible for people at home.
Yeah.
But what we're trying to do is to.
We will try and bring them into the
Yeah.
discussion as well as much as we can.
Yeah,
Yeah.
so not in informal discussion, not in formal statements probably, but if you just want to interject at any time, then you'll be brought in to do that. But I'll go and find the tech person to increase the volume. Well, the same department.
Yeah, they should be here, it's perfectly fine. Yeah, you're on
If
this.
you want to get a check of the levels, we could, whilst the panel's looking at the documents, with the other people here, are there any comments that you want to make about what your opinions are about what's important in inquiries? I think the main issues are we should be commenting on our statement about.
I think, my opinion, I lost my mother last week of the COVID. It was a challenge from the beginning. The government was too small to react. Sam did react. It was too late. It spread like wildfire in Britain. And people where I'm not taking notes, I would say, well, it's government block and things, and you know, until people start dying, and people realise how serious it was. Like I said, the time that had happened, no spread when people were panicking and you know, avoiding each other and you know, so yeah. Definitely needs someone to look at it and give somebody's blame for all this.
Any of the people at home got any particular comments they want to make at this stage about what their opinion is on?
Yeah, Stuart. And then Joseph.
Yeah, Stuart?
Hi, can you hear me?
Yeah, we can hear you loud and clear, thanks.
So I'm trying to get my video on, struggling. Anyway, we can't hear you very well, so I might have missed what you said. But I think the key issue for, I think, was the issues around sick pay and the fact that many key workers couldn't afford to isolate. I think there's about 12 million key workers who had no occupational sick pay, so they would have to take, if they had to isolate, all they would get was statutory.
Yeah.
And then you get what happened in September or the autumn of 2020 when they're looking into the pandemic response, and Dido Harding tells the government that only 1 in 5 people are abiding by isolation rules. I think it's a huge issue. It's certainly a huge issue where I work in the NHS. I think the other thing is the ongoing issues within the health service around COVID infection control. There's been this flip. So through most of the pandemic, the infection control measures were essentially the same as they were for the rest of the country. You know, we were basically, basically the guidance was treat everyone as if they're a potential source of infection, which meant that when we actually knew people had COVID, there wasn't additional protections for us unless we were performing what was called an aerosol generating procedure. And that's flipped sort of 180 now, so that they've basically got rid of staff testing in the NHS altogether, even if you're symptomatic. So the assumption now is that asymptomatic transmission doesn't happen. So I think it's good to have a sort of retrospective, but I think it's also about, you know, there's just, you know, the public health guidance and the infection control guidance in the NHS was dreadful and continues to be dreadful.
Very good points there, Stuart. I think the ongoing issues with the infection, not just in the health service, but wider than that, is quite important, because COVID hasn't gone away. And yet everybody's being told it is no longer a problem to worry about infection. We've just got an issue. But the other ongoing issue that I think I didn't mention in that list at the start is the issue about what's being called long COVID, people who are developing serious long-term health effects that need to be managed, and how that's being dealt with, particularly as it affects workers who are so disabled by it that it makes it difficult for them to carry on working. So that's another one we might want to add to the list. Joseph?
Yeah, hi, I'm Joseph Healy. I'm Jonathan and Janet know me already. I sit on the committee of COVID Action UK. Interesting that there are 1 or 2 speakers from Scotland here, because we're having our first joint meeting with Scottish COVID Action tomorrow. I retired last Christmas, but prior to that, I worked in the charity sector for about nearly 14 years. And as a shop steward in my workplace, I have to say it was a small disability charity, but my workplace was very responsive. And I managed to get HEPA filters installed in all of the office spaces, managed to get a very positive policy on masks and so on. Shortly after that, I became an officer with Unite the Union, which has been my union. And I was a regional officer for 6 months, up until last Christmas when I retired. And you won't be surprised to hear that because of my background, or because, you know, the issue of COVID and health and safety and so on, I should also say that I'm clinically vulnerable myself. So I was always very keen on the issue. But I found that I attended a number of workplaces as part of my job as an officer in the charity sector. And I was horrified by what I found there. I found law centres, CABs and so on, no ventilation whatsoever, no protective measures, no filters. So I could safely say that my workplace was probably one of the only workplaces I was aware of in the charity sector, certainly in London, where there was any sort of real proper protection. But I'd like to make the point that other officers, you know, and we're talking about last year, you know, this is not a long time ago, other officers didn't have the same awareness of the issue. So they were, you know, they were dealing with workplaces. Obviously, there are a lot of issues around pay and harassment and lots of other issues, but virtually nobody raised the issues of health and safety. And, you know, I was fairly alone in doing that. And I think there's a gaping lack of awareness in the union movement. I mean, one of the things I've managed to do in Unite, and certainly in our region, is that we, you know, the committees at least and so on are having hybrid meetings, and various measures like that have been taken. But certainly across my union, and I expect it's the same in other unions, there is now, you know, what Stuart was talking about a minute ago, this, you know, this amnesia, lack of awareness that the issue is still important, that it's still there. So, you know, if officers and if union officials are not even aware of the issue, or are not pushing for the issue, what can we expect from reps and from members? So, you know, there needs to be, I'd say, radical education really on the issue across the union movement.
Yeah, who's the next one? Head Phillips, you've got some comments?
Hi, yeah. I just wanted to add to and agree, I guess, with what Joseph's just saying. I'm a new rep. I work in the charity sector as well, and until I was switched to be allowed to work from home, I was working part of the time in the office, and I was the only person masking. We don't have anything, like, once so-called Freedom Day has come about, we don't have anything to protect the very, very vulnerable people that are being seen. You know, we don't have anything to protect colleagues. It's really I mean, what Stuart was saying about the NHS, the trouble is it comes from there down. Like people say, well, I don't have to mask in hospital, so we're, you know, oh, we're doing better than most places, and it's very concerning. And I'm the only union rep that is attempting to address this problem. And I don't mean to be inflammatory at all. I'm not saying this to have an argument, but I am shocked to see that this conference itself, you know, we're talking about ventilation, we're talking about COVID, we're talking about these issues, but no one is masking. It's concerning to me.
Thanks for that, Kit. Does any of the panel want to come back on those comments we had so far? Then one of the issues I think is interesting is this one about the union's own responses to it, because I think understandably all unions were very keen to get back to getting people together again, and conferences are being held. ASDA had its annual conferences in person as soon as they could do, and that meant 800 people all gathering in Blackpool in the Winter Gardens, and inevitably there was a lot of spread of COVID as a result of that at the time that that was done. And it wasn't the only one. I think United had similar experiences with their conferences too. We didn't manage it very well, I don't think, because we were as ill-informed and ill-prepared as other people were. But could we have done it better?
I suppose I feel like the trade union movement hadn't built capacity around health and safety, particularly, you know, we talk about government not being prepared, but actually the trade union movement wasn't well prepared to deal with this sort of crisis. And I think in some ways it was easy for me in UCU, being a relatively smaller union and being able to produce relatively radical guidance, but the implementation of that was where the barriers were. And I think with some of the larger unions, they were maybe a bit more hesitant to put in place, you know, more proactive, radical guidance that was in line with what Independent Sage are putting out, because they were concerned about the implementation and how they would then be able to support their reps. And I do feel like there's a capacity issue with trade unions and being able to, like, I really agree with that comment around education, and not just educating our own officers, but educating health and safety officers, and really boosting that and not losing what we've gained really through COVID, with the increased knowledge of health and safety and more awareness around legislation and, you know, controls that are put in place and things like that. So yeah, I think it's starting to just slip away like it never existed. I do agree with that.
Yeah, Jonathan.
Yeah, just to come back on the point of what the trade unions are doing, I think it's very important that we respond and respond better. I'm on social media a lot, especially Twitter, and lots of COVID kind of, I suppose it's a COVID bubble really. But there are comments coming from lay people now. What are the trade unions doing? And I think we should sit up and take notice. And this is particularly more apparent since the removal of masking in healthcare. And there has not been a response really at all. And I think that's very worrying. And I hear what comrades are saying about capacity and awareness. And look, we all live in the UK, and we're all subject to the same misinformation and minimizing and all that gaslighting. We know that's going on. But we know also that we are the only people who are going to defend ourselves and our members. The government's not going to do it. And I think what we should be thinking and talking about is to try and persuade leadership of big unions, especially the big health unions, I think, to at least issue a statement and say how important clean air is going forward, and how absolutely fundamental it is that healthcare and schools in particular are safe for patients and for children, because it's absolutely scandalous what's going on. Schools are going back next week. Some of them are back already. There is nothing. There are no mitigations in schools. There is nothing in healthcare. There's no masking in healthcare. We hear stories from clinically vulnerable patients that they postpone or cancel appointments because they're too frightened to go in to get their essential treatment. Stories of cancer patients seeing unmasked healthcare professionals and being told, well, if you don't want to come in, I'm not going to mask, says the doctor. If you don't want to come in, we'll postpone your appointment until you're happy to come in. I mean, this is not a good response. So I think that's really something on a clear list. I just wanted, if I may, Doug, just to respond to Head's point about masking. I think you're absolutely right in your head. I just checked my CO2 monitor. The ventilation in the room is excellent. It's 520 ppm, but obviously it doesn't protect against near field transmission. So we should be masking. So thank you.
Catherine, and then
I just want to, this is not a counter comment at all, but I do think we should recognise that on the other side of that, the argument, trade unions were some of the ones that were making the loudest noises during COVID and were arguing very much for more mitigation. Hazards did, Scottish Hazards did, some of the education unions, some of, social care unions that I was involved in. So I think we should remember that it's not all one-sided and that, yes, we didn't do a good enough job, but we were sometimes a lone voice, certainly in terms of aerosol transmission, and together with Independent Sage and a few others, it wasn't. So I think it's just to balance that out.
Very similar to what Kathy was saying, actually. It's looking at it, what do the unions do, what are they doing? Well, actually, when you're down on the ground and you are the only union rep around, we're getting nothing from our national. So we're like this lone wolf. And the only thing we're picking up is off the news or any research that we're doing. We weren't getting the information from higher up to support our members. And besides that, we were having to fight management as well. So it isn't just what the trade unions were doing. We weren't getting that information from our hierarchy or leadership. And I think that needs to be recognised.
I think it's quite a question of looking at it in phases almost, isn't it? I mean, in the initial phases of when it became clear there was a pandemic and there was an issue with it spreading throughout the community and the rules were everything for essential workers and so on. Certainly my experience in Usdaw was we did spend a lot of time working with the retail employers, working out practically what control measures they could bring into place, which was very difficult because there wasn't any guidance or information for public health to help us with that particularly. But we managed to reach some, I think, quite sensible conclusions, and we supported the compulsory masking of customers in the stores, fitting screens at checkouts to prevent that near field effect, social distancing by controlling numbers in stores. All that stuff was thrashed out very quickly with the major retailers. And in the major retailers was reasonably well enforced in the main. There were some exceptions, there were some that are better than others at doing it, but most of the big supermarkets certainly went along with it quite literally. It's more difficult, I think, in areas like social care and health because there wasn't the guidance and the problems were much more serious. But that was at the very beginning of it. When it was every day we were doing risk assessments across the piece with all sorts of different employers, food manufacturing and retail. Then there was a period where we had a period of a number of different periods of close downs and regulations that did make masking in certain circumstances compulsory for people and all the rest of it. And the fact that the law was there actually obviously meant that every then was hopefully working to that standard as a standard. Then there was the period after that, and that's the period from which we're in now, which is the one that worries me most, which basically the government seemed to decide it's okay, we can just ignore it now and pretend it's gone away when it hasn't. And it's going to come back and bite us sometime. It's quite unpleasant. And this is the period which is the most difficult one. Stuart. Stuart, yours?
Yes, thanks. I should have introduced myself. Sorry, I'm the health and safety officer for the East London Mental Health Unison branch. I'm a mental health nurse, which I think actually it's an interesting place to be as a mental health nurse in a mental health trust because you have to follow all the infection control guidance of the wider NHS, but actually our work is a bit more similar to working in social care, maybe, in terms of infection control risk. So our COVID patients aren't coming into hospital because of COVID, but they're coming in for other reasons, and we're having to care for them. I just wanted to come back on a couple of things. The thing about the trade union movement, I mean, I agree with what was being said about it's just lack of reps on the ground, but I think the guidance and the campaigns weren't very sharp, and there wasn't enough guidance about how you actually use health and safety law to win on these issues. I did my health and safety reps training in 2021, May 2021. I would have done it earlier if there'd been training available. So actually getting the reps training off the ground, I think, took some time. But I think there was one moment right at the beginning of the pandemic where there was a big opportunity for the trade union movement. It just missed it and lost. So the NHS England issued instructions on the beginning in March 2020 to all NHS trusts, saying anybody with duties in your building needs to be able to isolate on full pay. Now, this was an admission from a government department that decades of outsourcing in the NHS had created an infection control risk. And if it's good enough for the NHS, then it's good enough for everywhere, isn't it? I mean, most of the social care workforce don't get occupational sick pay. And they were I've spoken to care workers during the pandemic. They were like, I'm in a terrible position. I'm working with clinically vulnerable patients. I can't afford to isolate. I'm just hoping and praying that I don't get it. And there were millions of workers in that position. And I think if the trade union movement has taken that up and run with it, they could have overturned the government on that and introduce proper rights to sick pay. I mean, these exist in other parts of Europe. The UK's got the worst statutory sick pay in Western Europe. And I think that's a big fact. You know, when you think about hierarchy of control, yeah, how are we going to eliminate the risk? How are we going to eliminate the hazard from coming into our workplace? You know, isolation pay, sick pay, it's really big thing. And as I said, it was admitted by a government department that this was a problem right at the beginning. The second thing, I just want to come back on this thing about masking in healthcare. I mean, part of the discussion, I think, gets confused because we're talking about different types of masks. I think the big problem in the NHS is that we didn't have airborne precautions. They've never really introduced airborne precautions. So when you're in a room with a patient who you know has COVID, you're not told to wear respiratory protective equipment. You're not told to wear an FFP3 mask unless you've, I mean, it's a bit different in my trust now because I've been fighting on it for years now. But unless it's been forced through a health and safety committee, that isn't what the national guidance says. So there's a problem with airborne precautions, and that obviously relates to ventilation, HEPA filtration, and all of those things. And I think somehow the conversation about masks it's the most visible sign that somebody's doing something about infection control, but it's not the most important one. The loose fitting masks are a form of source control, not PPE. And it's low down, I think, on the list of things that can help you. And when we had to wear masks in the NHS, even if we were sat in our offices surrounded by colleagues who were testing twice a week, in that environment, you're probably never safer than, you couldn't be safer. And yet we were wearing these masks for 8 hours a day, just sat in our office doing our clinical notes and stuff. And it's very uncomfortable. And I think at some point you've got to say, well, this isn't reasonable anymore. We don't need to do it anymore. But the point there is you then have to have measures in place when you do know someone is infectious. And what are you going to do about that? And we've never had that properly in healthcare. And I think it's really disrupted the whole way in which we've responded to, in terms of lockdowns and everything.
Yeah. Joseph, you've got your hand up. Joseph Philly, yeah?
Yeah, I've been to the COVID inquiry a couple of times, and I've always gone on the days when the scientists are there, because as one of the barristers said to me, if you go on the days when the politicians are there, you just get guff. And I mean, everybody goes there for those days, but they're useless. But the really interesting sessions are with the scientists. And the professor of infectious diseases from Edinburgh said recently there are 22 potential viruses which are very, very dangerous. And he said that with COVID, we may well have been lucky, and that in fact, there's a selection of other viruses that could be much worse. Now, on another day, I was there, a senior civil servant who's now retired said that the government's plan at the moment for how to deal with such emergencies is not worth the paper it's written on. I mean, that's the reality now, you know, in which we are living. So if you go back over the transcripts or videos of some of the sessions, they're very, very interesting. But I think that you know, one of the organizations I think which is reprehensible at the moment is the UK HSA. And if I had my way, I'd have Jenny Harries taken out and shot, because they're issuing health advice, telling people to wash their hands and things like that, with virtually nothing else. I mean, you know, it's an airborne disease. And yet, you know, when members of the public go online, try and look for advice, this is the sort of things that they're seeing. They're not really dealing with the situation properly. And I keep quoting the law in Belgium. There was a law introduced last year, which is now coming into effect this year, that all public buildings in Belgium, all cafes, bars, railway stations, whatever, need to have clean air, CO2 monitors and filtration. And, you know, by the end of this year, that will be mandatory in all public buildings across Belgium. Those are the sort of measures that we need to be taking. Those are the sort of measures which the government should be introducing, because, you know, clean air is absolutely vital. And I think it's Jonathan and others have said that, you know, in the 19th century, the big battle was for clean water against cholera. Now the battle should be for clean air.
Very good. I think that the point about clean air and what the point that Jonathan was making as well about the need for the unions to give clear leadership, and that's a very good one, and one that we should certainly make a point of stressing in any kind of statement we make tomorrow. Anything else? There's another hand up, is there? Sorry, head. Yes, it's a hand up again. Yeah.
That's okay. Sorry, I only wanted to say a very brief thing, which was just agreeing with all of the above and Joseph, but just to add, I feel like definitely to add a sort of public education element to that, you know, like I feel like it is something that the trades union movement should be coming together to, because, you know, to a lot of extent, we're reliant on what our members are calling for. And if our members are being lied to and don't understand the risks that they're being placed under, then they are not able to then ask us to do that, if you see what I mean. Like, I think it's an element of what you're saying about putting forward a strong statement would be to let people know that.
Yeah, I think that's good. And the whole thing about the misinformation about masking is quite, in the health service particularly, I think is quite important. Those of you who weren't here this morning, when we had Ruben Adjus, the Emeritus Professor for Occupational and Environmental Medicine at Manchester, speaking at one of our sessions. He used to be a consultant in occupational medicine. He's now a retired professor. But he effectively said if he'd been a consultant still in working in NHS, he wouldn't have been able to cope with it, because he couldn't feel ethically that he could go around telling workers that they protect themselves from COVID by wearing a surgical mask, because it doesn't work. And there's always been this confusion between surgical masks and proper respiratory protection, which has never been resolved properly, which is a serious issue.
To say that I think that's a nonsense, really, because in healthcare they know how to protect themselves in infective, you know, there's infections around, you know, around dangerous airborne diseases. That's been established, you know, and it's like health and safety, you know. Sorry, I'm talking from behind you. But you know, even in like health and safety, you know, we know how to keep people safe in health and safety. The hierarchical controls that you know that we talked about, Stuart. You know, we know that that's an established procedure for keeping people safe at work, and that doesn't matter whether it's an infectious disease or in, you know, or something else. You know, some other harm. So those, I mean, that was the frustrating thing from our point of view, I think, at the beginning. That was known, and yet you know, these people that were in charge, you know, health and safety executive, in charge of hospitals, in charge of health, you know, chose to refuse to do anything about that. They made that decision. That was a conscious decision that they made to put people at risk when they all knew how you could keep people protected. Now, I think that's really frustrating. And I know you're concerned, Het, about the fact that we're not wearing masks here. You know, what we've said, you know, using that control market, we get ventilation right, and then hopefully we're keeping people as safe as we can in this environment. But there are situations in here, then we would, you know, we should be wearing masks when it's close contact. Just all the things that we know is right in that situation. But those scientists, those health and safety advisors, those inspectors, those senior health people, they should have kept people safe. It was established that people said, and why on earth didn't they do? And that's a political decision, not a conscious decision. I don't know, a conscious decision. It's a political decision that we made at that time.
Good point. Jonathan.
Yeah. Thanks. I just wanted to come back on follow up from what Janet has just said. I mean, I was making a list yesterday of the institutional failures that have happened as a result of COVID or during the pandemic. And it starts from the very top. The WHO in 2020, March 2020, you had Tedros saying COVID is airborne. Then you had Mike Ryan sitting next to him, scribbling a note. This is all on video, giving it to Tedros, and then Tedros says, "Oh, sorry, it's not airborne. It's droplet." And from that point forward, in fact, even slightly before then, a month or two before, there's no question that there has been a policy decision taken at the most senior levels, I think, of government and the corporations. Don't say this thing's airborne, because the implications for business, for corporations, and so on were very profound. They would have to have provided clean air. So it's quite clear, as you say, it's been a political decision. So this is just my little list, just off the top of my head in 5 minutes. WHO, Public Health England, UK HSA, Chief Medical Officer, Chief Scientific Advisor, Infection Prevention and Control, Health and Safety Executive, NHSE, NERVTAG, Association of Directors of Public Health, the Royal Colleges, the Royal College of Pediatrics and Child Health in particular, and I'm sorry to name them, but I think we should be naming names at this stage, have been diabolical. They have minimized infection in children. They have said they don't need to be masked. They don't need mitigations. They don't get infected. Then they can't pass it on. They don't get seriously ill and so on. And now we know from studies that 70% of household infections are brought home by the children. We know this, to vulnerable parents and grandparents and so on. So I think all these institutions, and this has been a real eye-opener, have been corrupted and coerced into abandoning their basic principles, their basic ethics. And as you say, Janet, they're there to protect us. They are there, they have principles. I mean, infection control has become a laughing stock. They have abandoned the basic principles of public health. They don't exist anymore. The Public Health Association, I don't know how they can walk around with their heads up, because public health has been eviscerated in this pandemic. There's a concept now of individual public health. I mean, what is that? I mean, it's a complete, what's that, oxymoron, I think is the right term. And we know as trade unionists that the solution to this is collective action. It's in our bloodstream as trade unionists. And this is really what we have to get going. I just wanted to come back to Kathy's point, if I may, about it's not the whole trade union. You're quite right, and thank you for the correction. There's been some sterling work done by Hazards and a number of other groups. But I think as a grouping as a whole, the trade union movement, I think, from the TUC level, really, I think it should definitely at this point, and I think it's timely. There's some nasty new variants around. There's a new wave that started. Winter has come. I think it would be very timely if we could get some national trade union leaders to issue a statement and saying, we need clean air. And then the workers on the ground will feel empowered to demand this much more. At the moment, all we've had, well, again, I'm generalizing, forgive me, on the websites of many trade unions is we're following official guidance. And we know now that official guidance is junk, it's rubbish. The IPC guidance is anti-science. It still does not recognize airborne transmission in healthcare, which is just mind-blowing at this stage. Thanks, I'll stop there.
That's very good. I'm beginning to see sort of 3 clear themes coming out of this discussion that we probably need to address when we get into the next session and we start talking about the statement we're working tomorrow. One is the thing about clean air. I think that's crucial, and the ventilation issue, and the fact that it is airborne infection. And there's a number of streams under that. There's the fact that there were experts who are warning about it and being ignored early on in the process, that there's not been proper public health advice, recognising, as you said, Jonathan, it's even yet, which is quite serious. And a number of things we can do around that, comments we can make around that are important. I think, particularly drawing on Stuart's points, the things about sick pay and isolation, being able to isolate if you're infected is still an issue. I mean, you shouldn't be expected to go into work if you might be infected, not even just with COVID, but with flu as well, because we're anticipating serious flu, not an epidemic, but a serious wave of flu this winter as well. And again, they were going to delay the vaccinations for that at one stage, and something decided to bring it forward in a way which isn't going to work because it's not practical to gear up that quickly for that. I think that the TUC did do some work around sick pay, and the fact that we were one of the worst in Europe. And I can remember certainly Shelley Asquith, who was the health and safety policy minister in the TUC, making some very good statements about sick pay, but I'm sure we could have done more as a union or a union community to actually coordinate action on it and make those demands more with the employers. But it didn't just affect health workers. It was an issue as well in areas like food manufacture. Anywhere where there was lots of agency workers who were on minimum wages and minimum employment terms, they were coming into work when they shouldn't because they were frightened of losing their jobs. And that's a nonsense that you're trying to control infection by keeping people who might be infected out of the workplace. And then there's a section all around the infection control stuff and the masking policy, particularly in the health service, and all the things that have gone wrong with that. Because there was total confusion before the pandemic about what the point of wearing masks was and what kind of masks were appropriate for what situation. And that's even worse now than it was before because there's not been proper evidence-based approach to it from the authorities. So those three streams seem to be the ones that have come through most strongly so far from the stuff we've been talking about. Are there any of the other issues that Andrea then?
Yeah, I mean, I was just going to add sort of kind of ongoing stuff and around long COVID.
Yeah.
Some of the submissions have you know, sort of mentioned. So you know, the NEU particularly have kind of flagged up the fact that I think teachers are the most affected. Teaching and support staff of the occupational group worst affected by long COVID, and just that sort of sense that, you know, people who were being clapped, you know, in the early stages or sort of height of the lockdown, you know, we were all standing on our doorsteps clapping them, and they've kind of been thrown to the wolves, and you know, some of them have lost their jobs because you know, there's sort of long COVID support groups that have been set up. You know, there's some horrendous stories about people who've contracted COVID at work and are then very ill and have, you know, particularly in the NHS, including doctors. I think the BMA have done some stuff around it, that people are just basically, you know, they've lost their health and they've lost their livelihood. I mean, there just doesn't seem to be any kind of resolution for those people. So I think, yeah, there's a sort of ongoing situation with long COVID, but and I think you've mentioned as well, you know, it's not over. There's another, you know, there's a sort of potentially dangerous variant at the moment, and they've kind of brought forward the vaccination, and there's just nothing in the way of kind of any kind of measures being talked about in terms of, you know, controlling or mitigating that at all. Yeah, so I suppose the ongoing situation as well as the, you know, kind of what's the failures that have happened, there's kind of ongoing failures is what I'm trying to say, very long-windedly.
No, that's a good important point.
Yeah, just add some things that we've been talking about in Scotland, which I'm sure other people have too. One of the main ones is that it was never recognised as an occupational health condition, disease, issue, whatever you want to call it. And certainly by the HSE, who just consistently said, this is not work related, it's about where you live, where you know, it's about whether you're in a minority ethnic group, whatever. And that's linked, I think, to two things. So one is, I think we have to be saying, this was a work-related condition, as well as a public health one, not just, but it was, and it wasn't recognised as that, it wasn't treated as that, it wasn't, that can't happen again. That has to, you know, we have to see this kind of public health issue as also a work-related one. And that's linked to the whole issue that was being raised, which is more about long COVID, of whether it's going to be recognised as an industrial injury, and which it still isn't here, although it has been. So I think those two are linked, and the third link of that is we have, excuse my language, shit occupational health services.
Yeah.
And we need to be saying, we need good occupational health services. We need people in this situation who can come in and advise employers, workers. And I know some occupational health professionals did the best they could. They're very few and far between on the ground, and and so all of that. And I think the other two things that we've been talking about a huge amount in Scotland is the lack of risk assessment. Just employers were not risk assessing. They weren't consulting workers when they were risk assessing. They weren't telling their workers when they risk assessed, and the lack of enforcement. And in Scotland, we have a real combined problem because health and safety is not devolved.
Mhm.
And so, our Scottish public inquiry for COVID, we're having to skirt around the fact that enforcement was bad because we can't say it, because it's not a Scottish government power. So we're highlighting public health enforcement, which should have been, because the Public Health Scotland Act gives enforcement powers, but it wasn't being used either. So I guess those would be the things I would add: risk assessment, enforcement, and occupational health.
Sure. There's a hand up. Stuart.
Thanks. So I'll try and be brief. I know I've spoken a few times.
Okay.
I think that the thing around the thing you're saying around the airborne transmission, the WHO, COVID is not capital letters airborne, and then there was never a point where they're like, oh, we're really sorry about that. We're really sorry, we got that wrong. Like, we've looked at the evidence. The evidence is mounted up. We made a mistake. It is airborne. Everyone needs to use airborne precautions. That never happened. And it didn't happen in the UK with public health body either. And even now, if you go and look at the NHS England infection control policy, you can pretty much work out from it that COVID is airborne. Yeah, but you have to scoot around quite a lot to find it out. Consult Appendix 3A. At the bottom of Appendix 3A, you get back to, and if you persevere with it, you can make your way through the maze of the policy to find out that you should be wearing an FFP3 mask. And then what happens at a trust level is the infection control team take that policy and they just reproduce it for the staff. And they do that regardless of what it says in the risk assessment as well. So we've actually had quite a lot of success in my place at getting the risk assessment that actually addresses the concerns that we've been raising. But, infection control just seems to do their own thing. And then, and at that level, they say, well, you just do whatever it says in your risk assessment. And there isn't a trust, I suppose it's true across the NHS, there isn't a trust-wide risk assessment. They devolve responsibility for doing risk assessment to individual team managers. So if you're like me, like staff side lead for health and safety, in order to get something changed by using our rights under health and safety law, I've got to go around and get 400 odd risk assessments changed, for every team in the trust, because there's nobody who takes any responsibility, and, it's not lost on me that a lot of these people work from home during all the most dangerous parts of the pandemic. So yeah, I mean, yeah. I think you said about that. I think the TUC and the Labour Party as well, and Corbyn did some good work around sick pay in the early stages of the pandemic. I think what was not clear in the trade union movement is that sick pay isn't just a terms and conditions issue for the outsourced workers, but it's a health and safety issue for everybody else. And you can use health and safety laws to win sick pay for your colleagues. And yeah, I think that, you know, it's very obvious when you're on the ground, you know, and the people cleaning your clinic can't afford to isolate and saying, telling you that they can't afford to isolate. It's really clear that that's affecting your health and safety. I'm not sure it was so clear to people higher up the labour movement. So, but hopefully that's something, you know, that's something we can change. I mean, in my trust, we've had some success on that. So they're going to look at all the outsourced contracts because they recognise it's an infection control issue, not just for COVID, but it's an infection control issue for every. And the big, they renegotiated a big contract, the biggest contract with our biggest outsourcer, and made sure sick pay was part of the new agreement. So I think there's certainly potential there, I think.
Okay, Janet.
Wandering around over there because I'm checking the screens. Just to say that, you know, I agree with what everybody said, but I think in particular, you know, at the beginning of the pandemic, when they changed the definition of what was a highly consequential infectious disease, and they downgraded COVID as that. That was where it all went wrong. And that was a deliberate act. And on this back to this deliberate act, they deliberately did that for all sorts of reasons. It probably once was about keeping business going, and you know, all that because we saw some really conflicting things at the beginning. You know, keeping construction workers building luxury flats at the same time as we were told to, you know, to isolate. So that contradiction took place there. I think highlights, you know, why that was a nonsense. And they knew how infectious. I mean, it should never have been downgraded at that time. But the consequence of that downgrading meant that they didn't have to isolate people. They didn't have to, you know, put in place those precautionary approach to it in hospitals and care. It meant that the HSE then could take a back seat. And mind you, the HSE then took the back seat, gave them the excuse not to enforce health and safety law. And as a result of that, you know, they not only did they not enforce health and safety law, they didn't, you know, no enforcement. But where we had, you know, like in UCU, where we had examples of where people died, and there's all sorts of really good witness statements and evidence that that was a consequence of that employer not protecting, you know, not putting in place protective mitigation that was necessary. Absolute evidence of that. They said, oh, they dismissed it.
Yeah, it's not.
And then when the full-time officials pursued it, they eventually investigated and still said, well, yeah, they might have done, but they also could have got it on the community, even though there was all sorts of evidence about that. So huge, deliberate that they would not investigate, not enforce, and they were never going to be there. So that political influence, maybe because they put in place in things like the HSE political appointments, really. That, you know, you said the trade union involvement in that, but you know, also, and then, you know, and then all things that Joan will be aware of in care, what happened in care, you know, people that she's representing, which was a deliberate killing. You know, we put infectious people back into care homes where people are really vulnerable. And another in the comments, you know, and that's been said in the comments about, you know, now we've got disabled, we've got vulnerable people who, you know, who can't leave their houses, who are, you know, who are just being dismissed really, as, you know, we're not really bothered about where they enter into the communities and if they've got any involvement in the communities. And it's, you know, there's all sorts of really, I think, hard things that have happened. Oh, that's weird, but real bad things that have happened that we need to have on record. That it's not right what's happened, and it's, you know, and you know, in the workplaces where workers have died, where workers have been ill and got COVID and continue to get COVID, and then these are in trade union workplaces, but in the non-trade union workplaces, these people have been left, you know, absolutely just left to get infected and die because there's no support whatsoever for them.
Yeah, I think that's where the inequalities, health inequalities thing comes in as well, because the people who are most at risk in the workplaces were people from were women in low-paid, insecure jobs, and black and minority ethnic people in those kind of jobs as well. They were the ones who were doing the jobs that exposed them to high levels of risk, but didn't have any kind of protections at all. The cleaners and people like that, and taxi drivers and people like that, were the ones that are very much at risk in that whole process, because there was nobody to represent them and look after them. I think the issue about the HSE is actually even more serious than that. The problem with the HSE is if you look at their guidance on how they're going to deal with a community-based pandemic, it quite clearly states that they don't see it as their responsibility.
They've said that
Because they're born
consistently.
responsibility immediately to public health and leave public health to do things. And any change of the regulations that came in were done under public health, and therefore, as far as the HSE were concerned, they couldn't touch them. They wouldn't look at them and they wouldn't enforce them because they weren't health and safety laws. And that's an abdication, a deliberate abdication of a very fundamental principle, because quite clearly the workplace is one of the places where transmission was going to be a problem, and one of the places where the employer had a duty to do what they could to control that transmission and prevent it. Sorry.
One more speak, but we're going to have to break.
Yeah, sorry, we'll get to break. We'll take it first, and then we'll go back in after.
Sorry, I'll try and be very quick. I only wanted to say, I mean, to agree that workplace is such an important element of transmission, because leisure places are workplaces. People talk about, oh, I'm just going to do this thing one time, but that's where the people, people work in those spaces. And just the only other thing I wanted to say was that me and a couple of other people were talking in the chat about this, and I just wanted to put it above the line, as it were, into like speech, that it would just be so good to see the trades unions come down on this as a eugenics issue. Like, I know that that is an inflammatory word, but like as an issue in which disabled people are being treated as disposable, and people are being disabled and are being rendered in that disposable population by these decisions and by collective inaction around them. I mean, I know I'm not the only person saying this, but I just wanted to get it above the line,
Very quickly, Jonathan, if you've got.
Yeah, very quick. Thanks, Tyler. I thoroughly agree with that. Just to how to take them forward and what we should be doing. Just two suggestions. I think the trade union movement, I think, should embark on an education program. The pandemic's changed. It's no longer deaths and hospitalizations. It's all about long COVID and repeated reinfections, and how that's damaging us. And we are all getting reinfected over and over and over again, without any end in sight. Because if we don't mitigate airborne transmission, we will carry on getting infected over and over again. And the other suggestion I wanted to make, and I'll be interested what the other panel members think of this, is keeping open these sessions. Maybe on once a monthly basis, or something that's manageable, because we're all very busy and very overcommitted already. But to give ordinary trade unionists and members on the ground, as well as organizations, an ongoing opportunity to make submissions and to keep this alive, and for there to be a channel for workers to express what we've been talking about today, their pain and suffering and their losses and all that sort of thing. And I don't know if this is too ambitious, but as long as the official inquiry keeps running, we could keep running something like this. And I think maybe something like once a month we could all get together online and advertise them and have future sessions.
I think that's a very good suggestion. Yeah. Okay, we're going to have to stop it now, because it's time for people to go and eat their dinner. We're back in here at 8 o'clock, and we've got an hour again from 8 to 9. And I think what we need to do in the next session is really hammer out what we want to say in that statement that we make tomorrow, based on the discussion we've had. I think there's some very clear themes running through it that we need to say something on. It's going to be very basic and generic. It's not going to be detailed stuff at this stage. But particularly if we keep the discussion going, as Jonathan suggests, we can refine it. That'd be great. Thanks very much, everybody. Thanks to you all for joining in. I hope you can come back. Sorry, Stuart.
Can I just ask, are you expecting like a different online, like, are you expecting us to come back? Is it for the second session? And
you're welcome back at 8 o'clock if you want to sign in, and we'll continue the discussion as we have done. You contributed, so yeah.
And I did a written submission, because I think this was supposed to be happening in the spring. You have that?
Yeah, the panel has
got all of those. Yeah.
Okay. Okay.
Right.
See you at 8 o'clock then. Yeah.
Thank you very much. Yeah. Thanks.
Bye now.
So is
Forgot to.
I just say that, sorry, I was playing around with the. We're gonna start in a minute. Thank you.
Are there any other projects online that we don't?
Yeah, there's oh. Yeah, at least.
Go out and do observations, measurements.
Yeah, so-
I might take some.
Ah, yes.
Go back.
No, gonna be. No,
Europe was coming back every
hello, who's the user on the You're still muted. Connor? Are you there?
Post exertion relays, it's called.
Hello?
Don't forget that she'll talk to me. She'll forget words.
Yeah.
Can we keep the voice down for a minute, please? Quiet. Just check this.
Stuart, can you hear me?
Yes, can hear you, yeah.
Brilliant, thank you. Connor, are you there?
Yes, I'm here. Hello.
Great. Do we know who the user is?
User, who's the user? This sounds like something off, isn't it? User. Excuse me? Is anybody behind user? Oh, then, that's definitely something like James Bond, isn't it? Okay, are you there? You're on the mute.
I did say hello in chat.
Okay, I missed that, sorry. Yeah, all right. We'll make it start then.
Okay. Well, welcome back and welcome to the other people who have joined us for the second stage of the workers' inquiry into COVID. In the first hour that we had, we just went through a general discussion, quite an informal session to discuss some points. What I'm going to do in this one is very quickly start off by introducing the panel that we've got. And then I'll summarise what I think came out of that earlier discussion and what we need to try and do in this session. We'll take a few more comments from you guys who've heard what we said so far, but our aim by the end of this session is to have an idea of what sort of a message we want to give to the conference tomorrow at the plenary session based upon the findings of the inquiry. And then we can refine that if we need to a bit after that. But we've got to have some sort of a statement to give tomorrow, which is the outcome we want from this session. To talk about the panel first, my name is Doug Russell. I'm the retired Health and Safety Officer from Union Shop Distributive and Allied Workers and a member of the Greater Manchester Hazards Centre Committee. Do you want to introduce yourself?
Yeah, so I'm Andrea Oates. I'm a freelance journalist and a member of the NUJ, and I work mainly sort of writing health and safety content for Labour Research Department publications.
I'm Kathy Jenkins. I'm my Unite branch health and safety officer for the not-for-profit sector, but I'm here from Scottish Hazards as well as Unite, and yeah, that's me.
Hi, I'm Jonathan Fluxman. I'm a retired GP, member of Doctors in Unite, and also on the COVID Pledge group.
Hi, I'm Jo McNulty. I'm a branch officer for Union Service Condid, and I'm the chair of North West Region and National Health and Safety Committee.
Thanks very much.
I'm
That's all right.
I'm Alex Lancaster and I'm the National Health and Safety Officer for University and Colleges Union.
And as you see, we've got some people who have come back to join us online as well. We might try and involve in the conversation. Essentially, the reason we're doing this is because obviously the main public inquiries are going on in Scotland and in England at the moment. And they're very sort of formal, very difficult things to actually get an input in. And it's quite likely that some of the key points that we want to put across as hazards campaign is going to get missed from that process. So we're just trying to pick up on some of the issues that we think are most important and make some sort of a statement which we then carry forward. But one of the suggestions that we finished up at our last session we spoke from Jonathan was that we might turn this into a regular event and hold perhaps monthly online meetings where we could continue to discuss as the public inquiries go on and adjust our inquiry as necessary as well. And if we do that, I presume that we could try and publicise that to get other people to keep involved and interested as well. But essentially, all of it arises out of the public inquiry statement itself, and we've identified, I think, a number of headings that came through very strongly from the discussion we had before dinner. One was the inadequacy of risk assessments by many of the employers at the beginning of the pandemic and the problems that caused for people. In particular, the problems it caused for Black and minority ethnic workers and for women, because they were often the people who were most at risk in the low-grade jobs, low-paid jobs, insecure employment, most exposed to contact with people who might be infected and having nobody to represent them. So that was a serious issue. There was a lot of discussion around the problems around sick pay, the fact that a lot of people didn't get anything more, when even entitled sometimes to statutory sick pay, never mind any kind of occupational sick pay. And that combined with job insecurity meant there were lots of people who couldn't isolate when they should. So if they knew they were infected or suspected they were infected, they were still dragging themselves into workplaces because they couldn't afford not to be working or afraid of the consequences. And obviously that is very bad news, as that's one of the main infection control measures you have to try and stop the spread of in the workplace. The fact that it was a workplace issue, an occupational issue, is crucially important, and that's something which big organisations like the HSE managed to duck out of very, very much right from the start, because they basically held their hands up and says nothing to do with us. It's a public health issue. All the stuff that comes through, all the regulations that come through are public health. It's public health law, so we can't enforce it. Our hands are not going to get involved with it, and that's been. They even made sure when they produced the guidance on reporting of the issue under RIDDOR that most of the occupational cases wouldn't have to be reported under their interpretation of the RIDDOR law. And that's quite criminal. That's negligence of a massive scale, we think, of the HSE not recognising the importance of the workplace as a major place where there's transmission, which could be managed if the employers took it seriously. There was discussion around the problems around infection control, particularly in the health service, and the massive confusion there was about masking. Suggesting that it was all right just to wear surgical masks, they would provide protection, or quite really proper RPE, FFP3 masks were necessary to actually provide you the protection. And that confusion was spread wider in the public as well, and it's made a big problem in the way that masking policies work in the areas. And infection control in general in the is described, I think, as a sick joke. It was just a farce based upon what's going on about airborne infections and spread. And for me, one of the strongest things that came through the survey discussion was that issue about clean air and the fact that it is an airborne infection. Something which even to this day, bodies like the HSE haven't really looked at in terms of their policy guidance, and so some of the guidance that is coming from public health on it is still confused in that as well. And that's got to be addressed for the current phase of the pandemic, because the other message we got to get across was it is an ongoing risk. COVID hasn't gone away, it's still here, it's still evolving and mutating into different variants. There's a new one coming along, which has got a number of mutations, which means it's going to be a little bit easier to catch. Fortunately, so far, it looks as if it's not going to be more serious as far as the health of it is concerned. But every time somebody gets infected or gets reinfected with COVID, there's more chance that they will develop some, excuse me, I'm just going through my teeth there. But there's more chance that they will develop problems, long COVID problems, ongoing health symptoms as a result of the infection. And that long COVID, the fact that there are tens of thousands of people in this country are suffering from those longer term symptoms is something that needs to be managed. We need the occupational health facilities available to employers so that they can manage rehabilitation for workers who are suffering from those sorts of problems. And that's a very serious issue. And I think that was a quick summary, but I think that was the main points that came out of the earlier session.
Lack of enforcement.
Lack of enforcement, I should have mentioned about HSE was, I should mention that one of the heading of the HSE, because of the position of HSE too, there was no enforcement effectively of the COVID precautions or protective measures in the workplaces of the day where they enforcing it. Even when they were called in, it took a struggle to actually get them to take action on those sorts of issues. And the problem was the same actually for people who were in areas where local authorities were enforcing authority. Environmental health teams were very busy doing other bits of the public health stuff, but they were basically told not to touch workplaces if they were. Should we actually see if there's any other comments, first of all, from the people who are new to the meeting? I know that was a bit of a rushed sort of survey, but are there any particular aspects of what happened over the last couple of years since 2019 you think would be most important to mention in relation to COVID as well, before we start pinning down some of those points?
I think you touched on it there, the sort of the policies around people and sick pay and stuff. And I mean, I work for BT. I represented the union, and how we made operational buildings, so telephone exchanges and stuff like that, safe, and it was relatively easy, but it was sourcing labeled signs because everybody wanted signs, it was a logistical issue. I think the thing that you notice is that for a considerable period, people who went off were following the guidance, were staying home, doing all of that sort of stuff because they were getting paid, because it's a big corporate entity, didn't want to look like it was bad, all of that sort of stuff. But the instant the government changed the guidance a little bit, it became that it was part of this thing, allowance. Yeah. But the irony is, if you go online and check, the NHS guidance is still, if you get you've got a cold and stuff, you should try not to mix with people. Yeah. But if you actually test, then it's still telling you to stay home. And actually, because I've left BT now, my friend checked it, and the guidance is following it. So it's like the company saying, if you get it, you should stay at home and try and work from home. But then a lot of people can't do that. Yet it adds up to your. So it's a very contract, and I think you highlighted that's a massive issue in the fact that people are just. It's like, well,
I think that's a very important point. I think that's one of the things that we would put into the current ongoing situation, and the fact that BT wasn't the only one. Lots of big employers were paying people to stay off when they tested positive. I've now relaxed that because government guidance has changed. It is just being treated as part of your sick pay, and obviously that means you're going to be lots of people are going to be more reluctant. They may have actually exhausted their sick pay already for other reasons, so they can't afford to stay off.
It becomes a punitive exercise rather than and the other one is the sort of clean air and environment. So I highlighted how crap many office call centre air conditioning systems are before COVID came along, and in reality, not a great deal, to be honest, has changed. Quite a lot of times they say, "Oh, we can open the windows," but if you're next to the A38 or the M5, that's not really going to be clean air. You might get rid of the virus, but you might get something else. It's.
Yes, there are clearly lots of other benefits other than the risk of COVID infection connected to having decent ventilation and proper clean air. And the suggestion from one of the panel was that we actually, one of the demands we make quite strongly, and as an outcome of this report, is that the big unions should take the lead on that issue, and the general secretaries of the bigger unions should issue a joint statement about the importance of clean air in the workplace to actually give it
So I'm Carol Revel, I'm the TWP Safety Officer for PCS. I did do a written submission, but you've said quite a few things I think I should comment on. I'll try not to do too many, because you might want to shut me up. Regarding the sick pay, what we were finding, we were getting sick pay in DWP because we've got good policies, but our security guards in G4S and our cleaners for Mighty were not getting sick pay. No. And we couldn't get the department to do anything about it. So we used the risk assessment and said, well, if they come to the office when they've got COVID, then putting my members at risk. And therefore we'll have to send my members home because you've got people coming in. So then the department paid the difference, so they got full sick pay. Right. So they didn't have to come in. And that was a real win because they weren't being paid if they didn't come in. So if an office got closed because it had COVID, the security guard would go to another office, even though they had COVID. So it was a real win that they would pay the difference, so they didn't have to come in. And that was something that we managed to do. We were also the first department to get a BAME risk assessment because it was obvious that BAME members were more at risk. And we got that put in, and lack of minority ethnics worked from home sooner than other people, unless of course they were clinically vulnerable. Because we got the BAME risk assessment put in. But what really annoyed me at the beginning, we asked them to put in measures before we got sent home, because we could see what was happening in China and Italy, and we said put in contingency measures just in case, and they refused to do it because the government hadn't told them they were allowed to do it. Yeah. And so by the time they did it, they couldn't get hold of sanitizer or anything like that because they left it too late. So that was really annoying. On the clean air, it was thanks to our hazards we got anywhere, because Hilda did a presentation for my DWP safety reps that we could then challenge management using the information Hilda had given us And they said, where did you get this from? I said, from our experts. It's our experts telling us the truth, and you're looking at the wrong guidance. So if it wasn't for hazard, I don't think we'd have closed all the offices in DWP. So that was really good as well. And we managed to get policies on people with school children, they could work from home, people with family with underlying health conditions. Although at the beginning they were trying to say every single person in DWP was an essential worker and had to go in the office, even though it was dangerous for them to go into the office. And we did get all the back of offices closed quite quickly. It took longer for the job centres, and we always wanted to leave somebody there for the extremely vulnerable customers, because our work coaches really want to support vulnerable customers, but we didn't want the whole office to be in because that was dangerous. And as a rep, it was really stressful because we were arguing with management every single day of the week, because we would get decent risk assessments in place, and then government would say something and we'd try and change them. We had a real battle about the fact we were for Whitehall government, but they had to abide by Welsh and Scottish legislation.
There was different legislation.
And they were trying to do that. So our negotiations covered all 3 lots of legislation, and we kept challenging different things. With the HSC, we did actually get them into one of our big offices that there was huge COVID infection, and they caught it from the staff bus going from the office to the station, because that was how it was pinned down from where it was coming from. And we got a really good person from the HSC that come with all those sort of things. The health and safety manager in DWP, because they were linked, HSC were linked to DWP at the time, went above the health and safety HSC officer to his manager and got somebody else put in so we wouldn't get the favourable treatment that he was saying, which was just to be safe. And we did get a risk assessment on the respiratory illnesses, and people could work from home, and we managed to keep it. The one we've got is respiratory illnesses, including COVID, and it said if people have any respiratory illness, if they're able to work from home, they should work from home, and if they're not, they should go sick. But under no circumstances are they to come into the office, which is useful now. They keep trying to take it off us every 6 months, and we fight to keep it. But everything in COVID has been a fight and a battle, and it's gone on for so long.
It's a very good presentation. Did you say you'd given a written presentation? Is
Yeah,
that
you've
covered?
got it in
I
your,
think one in your
yeah,
that's brilliant.
thank you to you.
That's great. And that's one of the things we ought to think about when we're doing this statement tomorrow, is to actually celebrate some of the successes that union reps have done. It's important to recognise we have a lot of hard work done by reps. Often it's been pointed out with very little guidance or help from the senior echelons of the union, because unions are no more prepared for this than anybody else was. Any other comments from? Yes.
Some of this falls into this remit, but I think a lot of employers use the definition of a key worker to their benefit.
Yes.
I work for the DWP, but as part of my department, that were no way key workers. You know what I mean? No one was a listen if they weren't there. Basically, it's like the broad side of it, and I think people would be glad if they weren't there. But they would. A lot of these were designated key workers who made to come in the office because at the time some of them didn't have laptops to work from home. And it was the representatives were like key workers. You know, this can wait, this can be put on hold. But now they were making them come in the office, and a lot of employers did that. You've got to come in, you've got to do this because you are a key worker. The definition is very loosely interpreted. So.
Good point. I think those comments are ones that we can incorporate into this statement that we've got the broad outline for, because they fit in with the headings that I gave them. What we need to figure out now is how we go about writing the statement. I think that's going to have to be done tomorrow morning sometime, isn't it, realistically?
Perhaps, somebody can put some notes together, Alex. Well, you've been writing lots of notes, like, no?
Yeah, she knows.
Is there anything else anybody wants to add to what's been said?
Kathy.
Can I just say a couple of things in response to that? We had quite a lot of, in Scotland, we were giving advice to non-unionised workers. I say we, not me, but our caseworker, Ian, and we had a number of instances where people were being told to come into work because they were essential workers. And it was clear that they weren't essential workers. And when we challenged that, We did sometimes win that because we would, you know, take it to the Scottish Government and say, this is not, you know, these people are definitely not essential workers. The other thing I wanted to say was, in Scotland anyway, I would say, I was on the Scottish Government Safer Workplaces group that met every couple of weeks, and we had the HSE there, we had local authorities, employers, every unions. I think that in Scotland anyway, the local authorities were much more proactive than the HSE. So I'd like to have that on record. I think they worked hard at doing what they could much.
As always with the local authorities, it was patchy across the country.
Yeah.
Some areas were much better. The Southwest was very good. In fact, one of the environmental authorities in the Southwest actually arranged an online meeting with the safety reps from all the stores in the Southwest to try and use them as a source to find out where there were problems with people complying with the COVID precautions. And she was very good, very active. But in other parts of the country, when our reps contacted local authorities because there was a problem in their store, they got...
Yeah, I can't speak for the whole of Scotland, but certainly the people that we worked with were...
But that's not unusual. That's the same pattern in all sorts of other health and safety agencies as well. Local authorities, there are some very, very good local authorities who are very active on health and safety enforcement, and there are others who just don't have the experience or the ability to touch it.
I'll just say that we found that Northern Ireland, the HSC advice that Northern Ireland gave at the beginning was a lot better and a lot more stronger than it was in the rest of the UK.
Is that still available anywhere? Is that still available? Because quite often HSE&I doesn't take things off its website.
No, I think there is still quite a lot of stuff on the
they're
website.
much
like,
better.
It was stronger. It was about get in touch with, you know, that approach that they took at the beginning was ring us up. If your employer is not keeping you safe, ring us up. And it was stark contrast to the HSC website, where not only could we not get hold of them, actually the link was broken.
Yeah.
So when reps were trying to report it, then there was just hitting a blank, like, you know.
Are they a completely separate organisation, HSC? Yeah.
A lot more work, they work a lot closer with the trade unions.
They do indeed. That's why the management rates would have practice is still available on the HSE&I website. It's been withdrawn by the HSE.
Right.
Got it, please. Yeah, a couple of points. Just in response to the comment from PCS, thanks very much for that. It was really interesting. I mean, PCS obviously was one of the unions that walked out over COVID precautions. I mean, it was in Swansea. The
DVLA.
DVLA.
Yeah, the 500 workers walked out because of their lack of protection. So, you know, it was great to see that, along with NEU refused to go back to school in the early days. Remember the big drive to reopen the schools, and the NEU said no. I just wanted to make a couple of other points, one about sick pay, and also where did people catch it. I think the sick pay question is really important and has been emphasized in the earlier session. But I was just thinking the other day, you know, people's contracts, our work contracts were negotiated pre-COVID. And there's a certain sick pay provision in the contract, right? 4 weeks, 5 weeks, whatever it is. Along comes a pandemic, which infects and reinfects continually, meaning that most people are going to get this virus once, twice, 3 times a year, and some more, which means that people are going to keep getting sick and keep needing time off, which eats into their sick pay. So the point about bringing the infection back to work has been well made already. But I think from the individual worker's point of view and their sick pay allowance, it's just not on. There's been a new disease that's introduced to humanity, and the workplace contracts just don't cater for that. And I think that's quite a useful bargaining point with employers. Either you mitigate and put in airborne controls, or you give us additional sick pay. Not either or, but both, really, until it's under control. And then lastly, the point about where people catch it. I am so fed up with hearing from the Department of Education, the Department of Health, employers. You never got it at work, you never got it in the school, you never got it in the hospital. It's in the community. It's like there's some fountain spewing COVID into the community everywhere you go, and people walk past and they get infected. But all these other congregate settings, badly ventilated, are somehow sterile of the virus. So when people say to you, got it in the community, challenge them, we know that at least 80% of transmission happens in poorly ventilated congregate settings. This is an airborne virus that spreads in super spreading events. In other words, 1 or 2 people infect 20, 30, 40 people. They then go out into other areas. It's not the one-to-one transmission. That happens, but the vast majority of transmission is in the workplace, at school, in hospitals, public transport, and so on. Thanks.
Which is why the current wave, the fact that the schools are just going back, just as the new variant is coming along, is such a concern. Sorry, I'll take it back and then come back to you. Yes?
I just wanted to make a point about the sick pay side of things. There's actually an additional element to it that makes people more invidious, which is some employers, certainly my employer, would say, well, look, you've had 3 instances of the same kind of sickness, and therefore we're putting you into a sickness process.
Yeah, it's not just sick pay, it's attendance management as well. Because most people have occupational sick pay schemes will have attendance management schemes in there as well.
Yeah.
And the 2 bits do go together, that's true. Sorry, you were.
Yeah, I was sort of going on to where people, when we sorted out the call centres, 60 to 70% of people were working from home that were able to work from home, but the call centres then themselves set up social distancing and mitigation to make sure that you had the appropriate, as I say, and we had one in Plymouth that year that, I mean, it still had a couple of hundred people in the building, but it could take 1,000. So it was, and you go there and they kept getting like 20 or 30 batches of 20 or 30 people catching it. And it was obvious that it was because they would get it all around the same time. So you're thinking, well, it has to be. But you go in the workplace and everybody was abiding by the social distancing until one of the union safety reps there looked at the window when these people went off shift, and they were all people under 30. And once they got outside the building to go, they all had a hug to say goodbye and stuff like that. So fundamentally, the workplace itself had done the mitigate, but when they got out of the building and in the car park, the social distancing and stuff went out. And it was like, it took, like 10, currently, and it would be 20, 30, 40 people getting it. And fundamentally, it was their interactions when they were leaving the building and not, and so, do you social distance the car park? And how it was trying to work out how far do you, apart from educating people in that instance, say, look, this is what's causing you to catch it. But it is that catching bit and the sort of, poor ventilation, it just wasn't emphasised enough. For me, it was such an emphasis about washing your hands. Great for personal hygiene, and it's something good to do, but actually wasn't a significant.
And in terms of COVID, it's not for my contact with surfaces is not a main transmission.
No,
it is for some other viruses. There's a hand up at the back. Yeah, Connor, you've got your hand up.
Yeah, thank you. From listening to everyone for the past hour and a half now, I think, and from my experience, I think there should be something very clear in a statement about the agenda of pushing ventilation to the side and pushing individual responsibility to the forefront. And it was absolutely an agenda of making sure that employers and the state who fund like public establishments like hospitals and schools and things like that wouldn't have to fund a ventilation because it's more expensive. And it was absolutely a push to make, and I think the comrade who said they were a GP mentioned that they didn't really mention it was airborne for a long time. And even now, it's not really represented as an airborne virus, except in the footnotes, right? And that's simply because they don't want to admit publicly, openly, that it is an airborne issue that would be resolved far more by resolving ventilation than independent, like changing your life around it or wearing masks more. Masks is very important. However, far more important in terms of in a room with 50 people is ventilation.
Yeah.
And that would have prevented so many people. And it would mean with fully ventilated public spaces, it would mean hopefully that people who are vulnerable are able to return with that extra safety. And not only that, ventilation is also incredibly important for other health and safety issues. It's not just COVID, it's carcinogens, it's general like things, you know, just airborne things that make you ill. So we should be pushing for a ventilated, clean air society so that we can basically try and bring the disabled people who have been pushed out for the last, well, you know, 2.5, 3 years now, back into society, and also push for a clean air society that workers can go in and not be at risk of like developing asthma, not be at risk of developing allergies in their workplace. And you can connect everything with ventilation through those things. I think it's pretty important that we do that. Yeah, and Em also just said that we can connect it to the, you know, ULEZ thing in London right now, because again, that's a carcinogen and people, you know, travel to work all the time, and it's putting at risk of clean air as well, and their illnesses.
Thank you for that. There was a hand up here.
Yeah, I just wanted to make you know if you were aware that some people that have been employed, various companies, say less than a period of 18 months, strictly as work from home, they're having forced changes made to their contracts, bringing them into work 1 or 2 days a week, like a phase return back into work, and being paid a paltry sum for that change. A lot of people have been comfortable working from home, and some of them have actually taken on that particular job or role because it specifically meant that they could work.
Yeah, personally, I think there's a lot of stuff needs to be unpacked around the sudden, well, it was forced on employers basically, the sudden decision sending everybody or large numbers of people to work from home, and then the fact that there are employers that are trying to go back when they're not ready, and equally there are other employers who have actually decided it's actually quite beneficial for them because they don't have to heat an office and provide all the facilities, and they're drawing up contracts for permanent home working, which are actually pretty. Certainly in call centres, the remote call centres, some of they're basically getting you to use your own Wi-Fi, your own heating, your own equipment, and make you get. And when you're using your own Wi-Fi, nobody else in the house is allowed to use it. So if you've got kids working at home as well, they can't use the Wi-Fi for their schoolwork because you're working for your employer at the time, which is quite draconic and ridiculous. And then there's the whole issues about people who were forced to work at home where it wasn't suitable. People who got disrupted relationships at home, and people who are working at kitchen tables in small flats, things like that are just not acceptable as well. That's quite a complicated area, which I think, from the point of view of this statement, I think we probably shouldn't get into that too much because that's something we might. But going forward, that's something we might look at now. That's actually changed the landscape of employment practices.
I forgot to say one of the things we did negotiate is that if somebody was off with COVID, it was a pandemic absence, it wasn't a sick absence.
That's right. Yeah, a lot of people had that during the main period of the pandemic, but once the government relaxed all the other precautions, lots of big organisations like Tesco's in our case, we just said, that's it.
Still need more training on ventilation because there's still issues now, so it's still need to do.
Yeah, the other thing that really worries and concerns me is that all these private, confident conversations that people are having from their kitchen tables with clients, and private conversations about their bank details, or their medical. And I always worry. I just think, God, do I? I don't know, because I know from people working at home, they're sharing with their other family members, so they shouldn't be allowed to, have all this information. So, because you never know if it's going to go to the home by someone.
That is one of the call center organisations, one of the international ones. Actually, they didn't get away with it in this country. In other countries, they've introduced cameras that you've got to have a camera on your computer which looks over your shoulder, so that they can look in and see who else is in the room and spy on you all the time, basically, to make sure you've got somebody in the background who can see information that they regard as well.
So that's the employer.
That's the employer.
They also want to be sure you're sitting at the desk.
Yeah, also you're sitting at the desk.
Having a glass of water.
Yeah. The whole thing about people monitors people working is quite a big issue as well. Lots of complicated stuff in there.
Talking about going back to work, I work at Preston City Council, and our chief executive is very keen for everybody to get back into work. Down the road at Lancaster, the chief executive there doesn't want anyone back into Lancaster. And it's surprising that two authorities right next to each other have got so different views on the situation. And I think that, they seem to be able to put in whatever they want because of the area that they're in. So if one chief executive gets up one morning like Preston and says, right, everybody back at work, that's okay. And yet Lancaster, another chief executive has made totally the opposite decision. And it just seems odd that they can get away with that as because they're all part of the same group of authorities.
Just, I think one of the things that we found, I think I said earlier, but in Scotland is the lack of consultation and lack of discussion, and that's exactly what that is about. So the chief executive makes a decision, that's it. It's not, let's sit down and talk with the unions about what would work. Should we have a hybrid system? Should we have, you know, people come in 2 days a week? But it's just like, this is the way it's going to be. And I think what was also not enforced, and never is, it certainly wasn't during COVID, is the you know, the rights to be consulted.
Very much so.
Rights to be consulted.
That was one of the things.
I think we really need to hammer that home. And say,
that was, I saw that as coming in initially under the risk assessment, but it goes all the way through.
Yeah, during the pandemic, it became quite clear, you know, when we could just go back into work in the hybrid, with the unions, or well, myself and one other colleague, we negotiated a new flexible working policy. So because staff were saying, I'm getting up, I'm working from 6 o'clock. So we've got a flexible working policy that runs over like a 13-hour day. And as long as you do your hours within that core time, our authority don't care, and it's working.
Yeah, I mean, there are one or two good positive examples of that, but there's a lot of other stories that are not so good. Is there another, sorry, let's see.
It's just to write in your coattails, actually, because I work at one of those free-flowing COVID fountains, previously known as. And with our school having a teaching school, they have been allowed to duty, it seems. But there was never so much any effort put into the focus of, but all our kids do have access to the technology, or we can provide it, or you know, my technology at home for teaching is actually better than I swear that. So I struggled to see why me physically being in a room, especially when there's only 2 kids physically in the room, everybody else had been bubbled out and went home, it just felt ridiculous at the time. It still does.
Just to come back to Connor's comment about ventilation being moved for other things apart from COVID as well. Well, HSE wasn't actually on the enforcement front. It has taken the lead on a lot of the research that was done into COVID in workplaces as part of the research that was being commissioned by the government during the pandemic. They struggled to get themselves into workplaces where there was actually an outbreak at the time when the outbreak was happening, for obvious reasons, because no employer was going to let HSE through the door if they thought that they could get reported actually. And they got some good reasons for keeping strangers out as well with infection. But they did get to inspect one poultry factory where there was an outbreak. And one of the things they did was to measure the CO2 levels around the factory to see what the air quality was like in the building. And in the offices and the changing rooms and the product control laboratories, there was ventilation and the levels were okay. In the main production area where all the chickens were being chopped up and processed, where most of the workers were working, was a big shed and there was no ventilation in there at all. So it was a big fan that circulated the air to keep it cool, but there was no and also mix up all the viruses that were around. The CO2 levels in the main production hall were 2,200 parts per million CO2. That's a level at which you actually begin to lose concentration. It's so high you get drowsy, you're actually at risk of having more accidents. People chopping chickens up with sharp knives, so it's quite crazy. And bizarrely enough, I was at an HSE, we organised a couple of conferences where they presented some of this research work to academics and people who were interested. And there were HSE inspectors in the room, and they just didn't seem concerned about the fact that CO2 levels were, in fact, it's a dangerously high level in a major reduction area. But there's a classic example of how good ventilation in that area would have made all sorts of differences apart from reducing the risk of the COVID outbreak. Any other comments or last thoughts about what we should try and put into the statements? Yes,
I don't know if we covered this, but personally, I mean, I do worry about the younger generation sitting at home and just learning. as far as I think they should come into the office with a young lawyer, because they will learn from being surrounded by experienced people. And I've got nephews and nieces who are training to be lawyers, and they say so when I was training, I used to just pop into my boss's office next door and ask him, questions all day long. Whereas they say they feel it's a bit awkward, because to ring their boss and ask a question. So I do then worry about the quality, when they, what are they going to be like? How good a lawyer are they going to be, or how good a medic, or how good a, So I do think, we should. I don't know how you guys feel, but I think people should go back. But when we've got the right circumstances, I don't think. I do worry about the next generation. I don't think sitting at home or with a laptop. I don't think they're going to be good enough.
Yeah, I mean, I suppose just following on from that, whether the statement, I don't know, we did discuss this earlier, but whether we should mention the COVID safety pledge, just within that statement around sort of. Because that is about having decent ventilation, isn't it? And and I can't remember who was saying earlier about in Belgium, they're bringing in all these standards, and because I suppose one thing that's kind of all the way through is we've handled things a lot worse than other countries, so just that kind of maybe something about the international comparison and that. So Belgium are bringing in those standards, and I think the other kind of, one of the kind of quite stark international comparisons was around, other countries had FFP2 and FFP3 in various, settings, and we were just, had surgical masks or nothing. So I think we were kind of, Dan called us, didn't he? Said we were sort of sick people in Europe or whatever. But I think in COVID, we just compare very badly to a lot of other countries in terms of what happened here or what is happening.
Just for the benefit of the people who weren't at the earlier session, I think was it Stuart who raised the point?
Yes.
Stuart raised the point that in Belgium they're introducing a law which means by next year all public spaces, including places like cafes and places like that, will have to have CO2 monitoring and air filtration to allow the public to use those spaces, which is a very positive step, I think. Stuart, do you want to comment on that?
Yeah, hi. I'm Unison safety rep in the NHS in East London. Just a couple of points. One is we're getting told in the NHS that that they're being discouraged from using CO2 monitors. So when we do our inspections, we go around with the CO2 monitor and we can see the areas of the hospitals that are poorly ventilated. And that's remained. And when we started doing inspections in 2021, we've done a lot now in a lot of areas. And there are committees of our organisation that are looking into ventilation, but there haven't been any upgrades, and we're just told that there's no money for it. But they're not even monitoring as well, and I think that must be coming down from NHS England to not use CO2 monitors. But the other point I wanted to raise was around outsourcing in general. I think outsourcing has been a disaster through this pandemic. I mean, there's been talk about the sick pay issue, and obviously that's a really big part of it. But it's also that the main organisation doesn't know what the outsourcing company is doing and doesn't know what that outsourcing company is communicating to its workers on the ground. And outsourced workers in my organisation, they didn't know how often they should be testing. They didn't know where to get the tests. They didn't know what masks they should be wearing. They didn't know their rights to sick pay. And even when the employer was telling us, oh yeah, we've organised sick pay for these groups of workers, that message wasn't getting through to frontline staff. The key bit of information there is those workers need to feel confident that they can take time off. And that's, that's a problem of outsourcing. It's also a problem of union organisation as well. And if we had, reps in every team, then, we'd be able to communicate that as, just basic trade union organisation. But, that's an ongoing project, yeah.
Yeah, I'm just going to come in and answer the international perspective, because we knew that there were other countries that did it well. New Zealand, for example, you know, and they brought together employers, brought together health, they brought together workers, all the different organisations, and every day or whatever, they sat down and they said, well, how are we keeping people safe in all the different environments? You know, because in some respects, you know, workers' health is public health and vice versa. You know, so we were saying all that. So we had examples of where it was and could be right. And definitely at the beginning, we were talking about what does make a workplace safe. And we know what made it, so we knew then in 2020 what made workplaces safe. You know, and you're talking about getting people back to work. We want people back to work in safe workplaces. You know, because for all the reasons, you know, because some of us want to get back in the workplace, or some of us don't. But there are, you know, we've negotiated all sorts of different contracts to keep people for benefits of individuals. It's been an opportunity, by the way, as well, so that, you know, people with care and responsibilities to actually work in a different way and to be more flexible. Yeah. So that's something. But I just think, you know, the government's intention, great business intention, is about destroying workers' rights, and they're doing it on the back of the pandemic. And you know, that's the thing that we need to.
So I'll hand it over here.
Yes, what I just wanted to comment was that whilst we hold employers responsible for creating better ventilated workplaces, I think we should also be campaigning for us, the employees, to actually make use of ventilations that are provided. Because I've been into offices where there are windows that could be opened, it's not like, and colleagues would refuse to open the windows because they're cold or for whatever reasons. So I think, yes, we also need to emphasize on that. We need to leave windows where possible open, and the adverse effect of having them shut. So that's just what I did.
Stuart's on the back, wants to come in again.
Stuart.
Sorry, that's just a legacy hand.
Oh, it's okay. That's fine. Well, we're nearly at the end. We're nearly at 9 o'clock, but I think we've got enough now to actually try and put together something tomorrow morning that we can present towards the end of the plenary session. I'll just leave you with one particular story about the issue of essential workers. We actually organised Tunnock's Bakery in Scotland, in Glasgow, which those of you who are Scottish or have been to Scotland might know is famous for Tunnock's caramel wafers and Tunnock's tea cakes. And the owners of Tunnock's actually decided that their products weren't essential and actually shut the factory down. And there was quite an interesting debate amongst the streets of Glasgow about whether essential food products. But joking aside, there were some very serious issues. There were construction workers being dragged in to build hotels and luxury flats and being treated as essential workers when it wasn't essential at all. And other cases of people being, as you say, the rules were used by some employers quite deliberately. Well, thank you very much for that. It's been a very good session again, and there's been lots of good comments that we should try and reflect in the statement. If the statement hasn't quite got everything that's been said here, that'll probably be my fault because I'm the chair and I'm the one who's going to try and do it, as you said, so my apologies for that. But we will seriously take up the suggestion that Jonathan made, that we try and keep this kind of discussion going at an online form somehow over the next few months at least, so that people can get together and share their concerns and share their thoughts about the way things are going. Thanks for that.
Yeah, and keep it as informal as we can, because I think this is where we benefit. I think this is the benefit of this sort of forum, isn't it? In contrast to the formal one, you know, public inquiry, which makes it really exclusive. What we want is something that's inclusive, where people can, you know, have their comments heard and make their statements. Thank you.
It's difficult getting it on two sides.
Yeah. One tip, by the way, that we got from one of the people in the earlier morning session: if you're following the English UK Code of Public Inquiry, lots of people turn up or join in to listen to the days in which politicians turn up to give their evidence to the inquiry. He reckons the best days to listen to it are when the experts are giving their evidence, because that's when you actually hear some more interested in quite shocking things. And I think he's right. I think that's quite. There's been some things said by directors of public health, for example, to the inquiry that were quite shocking, and basically saying that they were kept out of track and trace, for example, which is mad. Because they do that. That's part of their job.
And put the hand up.
Sorry, Em's got their hand up. One last comment from Em.
Hello, everyone. I wanted to ask, has anyone considered like teaming up with someone like the Corsey Rosenthal Foundation, they go around, they go and teach people how to like set up
We
the
have-
palsy.
We have Hilda Palmer here at conference, and she's been demonstrating Corti Rothenstall boxes all through conference. There's some in the
She's working with them.
yeah, she works very closely with the people in the States who developed the idea. And she goes and does presentations to union branches if you're interested in how you can actually make these things and use them. So yeah, we're aware of that. It's a very important point. And there are those kind of self-help things that people can do, yeah.
Could it be an option that maybe while we're waiting for clean air infrastructure to arrive, one of the things that we can do, like really on an autonomous level, like without outdoor authorities, we could really emphasize building these filters and getting everyone making this, and like really making this like person to person level, something that we can build while we're waiting for clean air infrastructure to, like, it will have immense.
That's very much what Hazard's campaign is doing.
Yeah.
And I think it's particularly important in areas like schools, because it's like a science lesson for children in schools to actually get involved in making these things and seeing what benefit they get from it.
Yeah, just that, we've been, Hilda has been at the fore of actually promoting that, and we've been supporting that, and making sure that people know about it throughout the Hazards campaign and throughout the trade unions, and actually, and encouraging people to do that. We shouldn't have to do, by the way.
No.
This is on the thing, our employers should be providing clean air for us. But, in the meantime, we would absolutely support that.
There's a way of shaping them to do so.
Yeah.
And by the way, one of the ones that Hilda's got here has got an amazingly quiet motor on it. It's quite an impressive machine. It's chugging away nicely. Yeah.
That's great.
Thank you for that, Em. That's great. That was a very good point. Okay, I think we should wind up, give people a chance to rest the grey cells before the quiz.
Well, it's a lumberal.
Yeah.
Thank you very much, everybody.
Many thanks.
And thank you all, yeah.
See you all.